Yesterday, we talked about a new report looking at the growing divide between urban and rural healthcare in Iowa. And today, we're diving even deeper into one specific aspect, the birthing centers. Get this, since the year 2000, at least 41 Iowa hospitals have closed their labor and delivery units. That's about a third of Iowa's hospitals, and they're almost all located in rural areas. But what about the births themselves? Those numbers have fallen too. Since the baby boom in the 1950s and 60s, the birth rates across the nation are down 14%. But in Iowa, births have dropped by 43%. Some of the state's rural counties are seeing birth rates down by 3/4 compared to the 1950s. And over half of the rural hospitals in the U.S. do not offer labor and delivery services. And in Iowa, that number is 62%. Joining us now to discuss this is Tony Lays, a reporter with KFF Health News who's been diving into Iowa's rural birthing centers. Tony, thank you so much for being here with us today.
Glad to be here. Thank you.
Well, the stats I gave seemed pretty jarring. How did we get to this point? What led to these circumstances?
Well, it's a combination of things. It's a big thing is shortage of staff, including doctors, also shortage of money, and then declining demand. And I focused on the declining demand in a story I wrote recently. And the reason I looked at the 1950s and 60s is because that's when a lot of rural hospitals were built or expanded. There was a big federal program that helped with that. And so that's when a lot of these hospitals date back to. And it just happened to be during the baby boom.
Hmm. So when birth centers and hospitals close, what does that mean for the staff that are left behind in these rural areas?
Well, can become a little bit of a vicious circle because if you're if you're in an area that's really short of staff to handle births, you don't want to be the only one because then you'd be on call all the time. So staff are both leaving to go elsewhere or they're retiring, and then when one of these units close, then they leave the area, and that means it's hard not just to give birth, but to get prenatal care in that area often.
I was listening to one of the interviews you gave earlier, and you said no OBGYN wants to be the only one in a community. Can you talk about that?
Well, sure. I mean, you'd be on call all the time, and can you go on vacation? Can you leave for the weekend? It's just really tough. And I think that's true of a lot of medical specialties, but especially this one because babies don't keep a schedule.
Well, I gave some stats about declining birth rates in Iowa, especially in rural areas. Is there a direct correlation here between closing units and fewer births?
Yes, when there's less demand for any service, there's going to be less supply. That just stands to reason. So yes, and then there's some debate about at some point the quality of care is not as good if your staff isn't getting as much practice.
So what happens from here? I mean, we know women are still giving birth in rural Iowa. Is this just the new reality? What can be done?
Well, it's toughest on people who don't have good transportation, don't have flexible work schedules, don't have childcare for their other kids so they can go to a prenatal appointment an hour away. So they could be tempted to skip some of those appointments, and that is not great. There are some programs, including from the University of Iowa, that are sending midwives and other professionals out into some of these small towns that have lost their labor and delivery units to at least provide prenatal care.
And what about consolidation? I know that was part of your report there when it comes to the rural hospitals that do still have their labor and delivery units left, but maybe can't staff them right now.
Yes, there have been some where a labor and delivery unit in a county that only has half as many births as it used to has managed to stay open by serving the counties around it. Um, that's the reality at quite a few small hospitals now.
Well, Tony, before I let you go, can you fill us in on, I think, one of the most important pieces when it comes to rural Iowa hospitals and births, and that's Medicare. How important is Medicare when it comes to families that want to have children?
Medicaid,
Medicaid.
right. It's very important. And it's more so in rural areas. Medicaid pays significantly less for all medical services than private insurance does. And if the majority of your patients in any medical treatment are on Medicaid, as a hospital administrator, you're going to be seeing a lot less money coming in than if they were on private insurance. So that is part of the story here. And the people who have good jobs and good transportation tend to be people who have private insurance, and they're more likely to go to the bigger hospital in the next city over, at leaving the smaller hospital to have even a higher percentage of Medicaid a lot of times.
Compounding issue. Tony, thank you
Hmm.
so much for your time here today and for your reporting.
Thank you for having me. I appreciate it.
We do have links to check out Tony's full report on this up on our website. All you got to do is click on the As Seen on TV tab.